and peers. Today, I like to suggest that essential workers deserve more pay and recognition than athletes in society. The highest paid athlete in the world earns over 200 million annually. Simultaneously, many paramedics, nurses, and firefighters rely on overtime or second jobs to survive. This financial gap is not just an economic issue; it is a profound moral and ethical one. First of all, diving into the topic, I like to discuss the entertainment value over necessity. For starters, athletes' pay disconnect. Athletes' earnings are a result of market forces, measuring entertainment revenue, not societal contribution. And secondly, the essential workers underpayment, excuse me, my apologies. The median salary for a registered nurse is approximately $81,000, while a firefighter hovers around $56,000. And then I have provided three athletes on the screen here. Does anyone in the audience know who these three athletes are? Yes, sir.
Patrick Mahomes.
Yes, sir. That's one of them. Far right. How much would you say the three of them earn all together collectively annually?
300 million.
300 million. So a little less than that, or it's a little more than that. My apologies. It's about $750 million. Three of them per year. While our registered nurses, healthcare providers, firefighters, paramedics, all of those essential workers make around 200,000. That is almost 3,000 less than the three athletes up there. And diving into that a little more, we're going to talk about the unequal distribution of wealth as the disproportionate resource allocation. The capital supporting a single athlete's contract can fully fund dozens of rural healthcare clinics or fire department resources. As representing the national conversation, journalist Michael Johnson stated in his July 2024 feature in the New York Times that the average annual income for a tenured public school teacher is less than the 50 million signing bonus given to a single top athlete. And secondly, ignoring social welfare, this disproportionate funding ignores the critical need for a stable, well-compensated essential workforce, as based on the official figures released by the U.S. Bureau of Labor Statistics in 2024, data show that the median annual wage for an entry-level essential worker, such as a certified nursing assistant, remains below $36,000, making it financially impossible for many to live in the communities that they serve. Diving into this a little bit further, we're going to talk about the workplace risk and how exposure they cause to our essential workers. For starters, the exposure to physical dangers, such as firefighters and police officers, are routinely risking their lives, entering hazardous, unstable, and violent environments, putting their lives at risk for us and benefiting our safety. And secondly, the chronic trauma and exposure, as healthcare workers face repeated exposure to suffering, death, and moral injury in high-stress, unstaffed conditions. And then that leads to, unfortunately, extremely low mental health and low mental health morale, as burnout rates soar, as low pay and exhausted hours drive high rates of career burnouts across all social services. According to the Center for Stress and Trauma Research, 2024's report on emergency services, 35% of surveyed frontline nurses and paramedics report clinical burnout or PTSD, and while first responders are now 4 times higher than the general population. Leading to our PTSD topic, as EMTs, paramedics, and emergency nurses, they say that PTSD rates significantly higher than the general population. Now, how does this affect us? How does this affect us as a society? Our institutions, our healthcare institutions, like our hospitals, are significantly working overtime and have that burnout and have that burnout in the workforce. It like devalues and kind of in the way like decreases their amount of work production, and it really helps. And it really it really cripples their workforce and how much they can help us. So it's crucial that we keep them as a top priority as they are serving us as a community. Now, diving into how we can do that, we're going to discuss the legislative reform wage. As for starters, we need to establish a living wage benchmarks as through advocating for state and federal policies that mandate a minimum salary for essential workers that align with their professional risk. And secondly, guaranteeing comprehensive benefits as demanding robust health, disability, and mental health coverage to protect those who protect us. Next, another way we can serve is through our cultural recognition through celebrating life-saving commitment. As direct public praise and media coverage towards great acts of service in hospitals and on the front lines, not just on the sports field. As from a show of hands, how many of us know I stayed over the COVID-19 pandemic? That's a lot of us here. That COVID-19 was a very monumental part of U.S. history, and it showed us as a society, how crucial our healthcare workers are, and how much we rely on the backbone of them, and how much they helped elevate us through that dark time in our place to the stage we are now, and help us really get to that COVID crisis. And secondly, through our support and direct resource allocation, through our lobbying for public funds and corporate taxes, incentives to be reduced from luxury entertainment venues toward essential infrastructure. As Eleanor Davis states, or asserts in a 2023 paper in the Journal of Ethical Economics, she argues that in a truly moral economy, compensation must align with the cost of societal functions, including that essential services labor is currently undervalued by an average 40%. Now, our society is built on the backs of undercompensated heroes, while we fund a spectacle of leisure with obscene amounts of capital. If you are already advocating for fair pay for essential workers, I urge you to amplify your efforts. If not, I hope you will commit today to joining the necessary fight to reprioritize our collective values. We can do this through starting a social media campaign and using the contrast figures we discussed in the slides today to write a letter to your local city council member demanding better pay for your city's healthcare workers and healthcare staff. Lastly, let us remember, as we close today, for us in the audience to remember that let us stop paying athletes millions to